Edwards, and will be your tag teaming co-moderators today.
Yeah, and we're doing it for the first time, so please bear with us. And the way the sessions are designed, we'll set the context, have a panel discussion after that in terms of so the idea is to explore what does just in just transition mean. And the question is not about just energy transition, which is essential, but what is the social justice aspect of it? What is people's participation aspect of it, indigenous communities, women, young people, what is their role? And it's a lot to discuss in 90 minutes, but we will make an effort to at least unpack some of that to see how we can continue this conversation, right? And so we'll set the context, we'll have a panel discussion, and then the third, there are a lot of speakers, and they're very, very exciting speakers. And given that we're trying to pack so much in 90 minutes, please bear with us because there will be some movement at the stage over here. And we will end with like a way forward session. And as Jess said, we are going to be your co-moderators today. And there is translation available?
There is translation into Spanish and Arabic. Get a headset if you would like to listen in Spanish or Arabic. Wonderful. Thank you very much.
Brilliant. So I'm going to moderate the first segment, which is setting the context. And as I was saying, the concept of just transition itself has different meaning to different groups. The labor movements look at it from a workers' rights and jobs perspective. The environmental justice movements have looked at it as from communities and communities' participation in a transition away from fossil fuel economy. The banks and multilateral agencies have looked at it from financial and investment and economic opportunities perspective. The missing link in all of these narratives is the one about health. And when we talk about health in just transition, we're not talking about health as a co-benefit. We're talking about health being foundational in deciding the pathways that we will take and the decisions that we'll take, which will get us to a just and equitable society, and which is different from the injustices that we see in a fossil fuel economy. I think I'm going to use this just word a lot, and my main mission over here is that once we go back, we have some understanding of this what are the dimensions in this justice and the just language. So today, in the opening session, in setting the context, we have, and we are still waiting for one speaker, but we have two powerful speakers that we have, and we have a doctor among us who's going to set the context of why this transition is urgently needed. And this Dr. Arvind Kumar from New Delhi is here. He's a chest surgeon. I'm not going to go into details about, so please welcome, about his background. Google search him. He's a chest surgeon and a clean air champion. And he's going to tell us why, from a health perspective, and why is a chest surgeon over here talking to us about the urgency of transition. Dr. Kumar.
Good evening, ladies and gentlemen. Thanks, Shweta, for those very kind words. I have been given 5 minutes to set the tone as to why we need to do this transition in a quick manner and in a just manner. So I've put my timer on. Last few days, we've been, for the first time in any COP, hearing that it's a health issue, it's a health issue. When I compare with the previous COPs, it's a major change that I noticed that this time, health, it's all about health. So we are all aware that it's a health issue. However, when I've talked to lots of people over the last 2-3 days, when you want to know what is the depth of health involvement, there are still a lot of gaps. And I thought in the next 5 minutes or 4.5 minutes available to me, I'll just share with you not something from theory, but something that I, as a chest surgeon, see every day with my own eyes. So as a chest surgeon, I open up 3-4 chests every day. This is the color of normal pink lung as we are born with. And friends, what I see nowadays every day in non-smokers is this kind of color. So this is the kind of damage that is silently occurring inside our bodies without us being aware. God has given us a lot of extra capacity. So what happens till such time that a lot of damage has taken place, we don't develop any symptoms. And when we develop some symptoms, it's too late. It's too late because whatever is deposited forever there. And this is what happens when you're a smoker also. So see the change. Now this is what air pollution is doing to us. And this precisely, ladies and gentlemen, is the reason why we should be talking of a quick transition, a complete transition, and a just transition. Because this also affects poor people, marginalized people, more than it does to the richer people. So this is the reason why it should be done. We breathe 25,000 times a day. And if your PM 2.5 is 200, 300, 400, as is the case with numerous cities across the globe, all that particulate gaseous matter which goes inside, even if a teeny-mini fraction of it remains inside, it gets deposited, it causes damage there. Breathing polluted air, and this is WHO, not Arvind Kumar, is equal to smoking, and 22 microgram of 2.5 is equal to 1 cigarette. So if your city PM 2.5 is 250, everybody in that city is smoking minimum 10 cigarettes. And that, unfortunately, sadly, tragically, ladies and gentlemen, includes the newborns also. A lot of time I'm asked, why are you putting newborns as smokers? So I ask them, when a newborn starts breathing, do you give him some imported air? Maybe you give him oxygen for a few hours. After that, he's taken out to the room. He breathes the same air which is there. And if the air is equal to 10, 15, 20, 30 cigarettes, as is the case with my city these days, the newborn also becomes smoker. So I dare say that in polluted cities, the newborns become smokers. Sadly, the story doesn't start there. The story starts even before that. When a pregnant lady breathes toxic, polluted air, those particles go to her lungs, go to her blood, and through the placenta, they start harming the child. So we have harmful effects starting even before we enter this world. And there is now data to say that congenital defects, intrauterine growth retardation, all kinds of things are now reported with higher incidence in ladies who are in polluted cities. To summarize, I just want to say one sentence. In polluted cities, breathing kills you. A lot of times I'm asked, okay, this is confined to lungs only. So then I need to show this picture. These are the only organs in the body which are afflicted by air pollution. But if you would see from brain to toe, you would realize that there is no organ which is spared the ill effects of air pollution. The lungs are the portal of entry, but no organ is spared. And this is my last slide I would like to show you. I'm a lung cancer surgeon. And this is comparison of my 30 years of difference that I have noticed. 1988, when I started my career, as you can see on your left-hand side, majority of my patients were smokers, majority in the age group of 50 to 60, very few women. And as I said, the color of lungs used to be pink. Now, 50% of my patients are so-called non-smokers. Why are the non-smokers developing lung cancer? Because they are not non-smokers. They are smokers. Even without smoking cigarette, they are smokers. Effect of pollution exposure starting early in life. Age has now come down to 40s. I'm seeing lung cancer in 30s and late 20s also, because you need exposure to 20 to 30 years for the cancers to develop. Earlier, people used to start smoking at 20, so by 50 they used to have. Now they are having it at the age of 30, and 40% of them. So its cancer is increasing. It's increasing in non-smokers. It's occurring at younger age group. It's occurring in women. How much more damage do we expect before we will start acting? Unborn babies, children, elderly, they are the worst affected. So it's a huge economic burden to patients, to society, to all of us. Direct cost of treatment, cost of absence from work, and of course, disease, disability, death, whatever price you want to put. If you put all this money together, which is occurring because of the pollution and climate change, and then you compare on the other side that if you bring about change, and prevent these from happening, you would realize that the cost of action will be less than the cost of no action. Thank you very much.
Thank you very much, Dr. Kumar. That was indeed the message that we wanted to set in terms of the context as to why we need to talk about a transition and a just transition. We had another speaker for this panel in setting the context, a climate and health advocate from Nigeria. But it seems, yes, thank you, sir. But it seems that there has been some delay, so we will move to our panel, which is about Jess. I would like you to, yes, oh, I'm sorry. But this is about case studies and criteria for healthy and just transition, and Jess is moderating this. Thank you.
Thank you, Shweta. And if I could invite Felipe and Louis and Lalita and Sarah, Michael will be here shortly, and Hannah to the stage. Michael's this panel. To the stage, that would be wonderful, please. Thank you very much. And I'm very pleased to announce, first of all, Felipe Pino from FEMA in Chile. Felipe is a lawyer from the University of Chile and a candidate for a master's degree in human settlements and the environment at the Institute of Urban and Territorial Studies of the Pontifical Catholic University of Chile. And I'll pass now, and he's going to introduce to us some concepts of social justice and why they need to be central in moves towards a just transition. Thank you so much, Felipe.
Thank you for the invitation. I'm glad to extend with you some of the knowledge that I have been addressing from my studies, but also from my work in FEMA. How much time do I have? Sorry? How much time do I have? 5. Okay. So I will just address a very little history of why we are talking about just transition in this scope, and why are we in a moment that the scope of that concept is broadening and inviting health also approaches. As is a hot topic for COP28, many of you maybe know that this concept was coined in the 80s from trade union workers, specifically that were leaving the closure of some of their industries, mostly petrochemical industries, and they were seeing that the government was not taking enough measures to address the health issues that these industries have been developing in the workers and in the communities that they are near to. So although the very first use of the concept was mainly used by trade unions, was because trade unions were suffering health issues because of their work. And they, for the first time, relate these health issues with environmental issues and an environmental agenda. So it was a very important moment. And at the same time, but with a different language, also in the US, we were seeing the first cases of the use of the idea of environmental justice. This is also in the 80s, so it's a very recent concept. Maybe many of you know the Warren County case, but it was also a case of very near toxic deposits near black population. So it was the first time that we, as social movements, started to see the social impacts of environmental activities, and it started to relate with vulnerable communities and also in that time, and today, of course, with environmental racism. So at the same time, in the same place, but in different specific regions, we have a just transition discussion burning and an environmental justice concept burning. This environmental justice concept was developed, was evolving with time. In the hurricane, in the first years of the 20th century, the hurricanes that were impacting the US also started to put people to think of how the impacts of human activity and their impact in environmentalism were trespassing frontiers. And that is the moment with climate justice arrived to the conversation. As just transition started to also develop and start to entering into the Paris Agreement and into climate negotiations. And then we have the current time, the last 5 years, I would say, in which we started to see how the just transition concept that has been developed for ILO and for trade unions in general is not broad enough to address all the impacts that climate action actually is addressing in territories. Climate action related to the closure of some fossil fuel activities, but also to the arrival of big-scale renewable projects that also have impacts in health. So the reason why we are talking about just transition today is because transition is here. And when transition arrives to territories, people start talking about justice. When they start to see infrastructure, when they start to see social impacts. And I think it's a very important discussion to have because, and I don't know if any all the decision makers that talk about just transition take this into account, but the justice part of the transition is always related to communities. Communities are the only ones who can address what is just and what is unjust. And now, thanks to this concept that has been developed for ILO, we are talking about justice in climate negotiations, not outside rooms, but within rooms. And this is something that it's new, it's exciting, but we have to take responsibility on it. And as in the beginning of the burning of these concepts, we need to look about the relationship of health issues, of environmental justice, and now, of course, of just transition. Thank you.
Thank you so much, Felipe, not least for being the most very recent addition to this panel. We'll hear now from Louis, who is Director of Strategy and Operations with the Lancet Countdown. The Lancet Countdown is an independent, multidisciplinary and global research collaboration of 300 experts headquartered at University College London's Institute for Global Health. Thank you so much, Louis Jamal.
Thank you so much, Jess, and thank you for that fantastic introduction, and to everyone for being here for this incredible event, incredibly important event, on a day where there are lots of other events talking about the just transition, but to center it around health and the importance of that. As Jess mentioned, I'm Louis Jamal. I'm the Director of Strategy and Operations at the Lancet Countdown on Health and Climate Change. And the Lancet Countdown was established back in 2016. It's a collaboration of, as Jess was saying, over 300 experts globally, tracking the impacts of climate change on health and the health opportunities of climate action. Many of you may have heard my colleague, Dr. Marina Romanello's talk over the course of this last week on the impact of the findings of that last report. And to summarize them, what we found is that firstly, climate change is already impacting health. It's impacting the communities who are the most vulnerable and who contributed the least the most. And what our projections show is that with every fraction of increase in temperature, that impact is going to get worse. But today I'm going to talk about a slightly different finding, which is just as concerning, which is that not only are the most vulnerable communities being impacted the most, but they are also being left behind in a transition to clean, renewable energy. So what we've found is that despite having an abundance of resources, despite consuming the least energy globally, the proportion of electricity generation from renewable energy in low human development index countries is only 2.3%. And that compares to 11% in your very high human development index countries. And not only that, but the rate of increase in that proportion is much, much slower in those lower income countries than in the very high income countries. That's not a coincidence. A lot of that is being pushed forward by increased subsidies in fossil fuels. A lot of that is being pushed forward through strategies to invest in fossil fuels in those areas to counteract the impact of reducing or of increasing clean energy consumption in the higher income areas. But that is having significant impacts on health. As Dr. Kumar was saying earlier today, there is a huge direct impact on health of this reliance on dirty fuels. In 2020, household air pollution resulted in 140 deaths per 100,000 people globally across the countries we reviewed. And as you can see here, within the low HDI regions, we have the highest dependency on burning of biomass to meet those energy demands, which has a huge impact on that direct health. But we also have increased reliance on these really unreliable sources of energy. So about 1 billion people globally are still served by healthcare facilities which lack reliable sources of energy. So what does this all mean? Well, what we've been seeing is that as we've had an increase in a transition towards renewable and clean energies in high-income countries, and that the benefits of that have been begun to show, lower-income countries have been left behind in this transition. And I think, rather than hear it from me, actually, the president of Palau said it very nicely earlier today. He said that rather than being a luxury, that access to renewable energy is a lifeline for communities. And I think that really summarizes that nicely. So what do we need to see for a just transition? Well, I think it's really important that a just transition is one in which all countries are empowered to transition from dirty fuels towards local, modern, renewable sources. And that will enable the health benefits, the socioeconomic benefits. But importantly, when we're talking about accelerating that just transition, we're currently moving in the wrong direction. So we'll start hearing from Felipe before that we're talking about this because transition has arrived. Absolutely, transition has arrived, but at the moment, those most vulnerable communities are being left out from that transition. And so rather than just accelerating the transition, we need to reset our course, change the direction we're going in, and accelerate that in a more just manner than has been done so far. Thank you.
Thank you so much, Louis, for that excellent presentation of the data. We're going to zoom in on a few case studies now from Sarah Whitney, who's Assistant Professor with the Pathfinder Initiative at the London School of Hygiene and Tropical Medicine. Thank you, Sarah.
Thank you. It's a pleasure to be here, as Louis said, and it's a great coming together of a number of organisations who are really focused on both promoting health and promoting a just and equitable transition. I'm going to give you a couple of very quick findings from a recent report that's come out. This is from the Lancet Pathfinder Commission, which was published a couple of weeks ago. There's a QR code on my last slide. And for a broader overview of the relationship between mitigation actions and health co-benefits. So we're really going to talk about solutions that can be achieved both for health, environment, and for improving equity. And I'm just going to give you a couple of quick examples from two sectors, one from the built environment and one for transport, just to show that we can achieve actions that do promote health and equity and mitigation in different sectors, and it's worth considering all sectors when considering your actions, and that really by taking a systems approach, when you start to think about it, thinking about the needs of the local communities before you undertake mitigation actions, you can deliver outcomes that benefit all across different sectors and hitting different sustainable development goals as well. These aren't our examples, but with Pathfinder, we've basically been trying to trawl for implemented actions that have measured both mitigation and health outcomes, and we've also looked for actions that have had a wider range of benefits as well, including for equity. The first example I'd like to give you is from Victoria in Australia, and this is a really nice example. It's called the Healthy Homes Programme, and what's really great about this is that they conducted a randomised control trial, which is quite unusual for implemented actions in mitigation. So basically, it was a project funded by Sustainability Fund of Victorian Government and Sustainability Victoria, And basically, it was a randomized controlled trial where they were conducting thermal comfort upgrades, so basically making people's homes warmer in low-income households across the state of Victoria. Relatively minor home upgrades. They basically cost sort of $2,000, but they had a wide-ranging amount of benefits over the winter period. They managed to increase indoor temperatures, and they also asked the people whose homes they'd upgraded what the mental health benefits were. They reported greater warmth, reduced condensation. They reported reduced breathlessness and improved quality of life as well. They've translated this into cost savings, so about 800, 900 Australian dollars per person from healthcare costs saved over one winter. And this was significantly outweighing the impacts on energy costs, so it really was promoting. And I think what it can show is that they also avoided CO2 emissions, and that led to a reduction of around 11,000 tonnes of CO2 equivalent per year. And so you can see that within the built environment, there are significant opportunities to both promote emission reductions and potentially save lives from well-designed actions. We have to think about ventilation within homes. These things have to be done right, or they will lead to significant impacts for health. But if they're done well, they can really lead to a range of different outcomes that are great for social justice as well. And within the transport sector, I'd just like to highlight an example from Buenos Aires. So basically, the city of Buenos Aires was committed to becoming carbon neutral by 2050. They put in a project called More Bikes, Less Emissions, and basically tried to promote active travel. They created more cycle lanes, promoted a bike sharing scheme, and basically managed to reduce over 12,000 tonnes of CO2 emissions in 2020. It led to a 130% increase in the number of bicycle trips, which increased physical activity, of course, promotes healthier lives and also reduces air pollution. And the way they really set up the system meant that the approach they took meant that they had fewer accidents, and the accidents that did occur were occurring outside the cycle network. But one really interesting feature of this was that they tried to make it safer as well. So they promoted the number of women who were traveling. And we've seen that in a couple of our case studies that we're sharing on our website, which I'll give you a link to in a minute. But really around thinking more broadly than just promoting active travel. How can we make it inclusive, affordable for everybody who is to be affected? And one of the nice things was that they thought about connecting different places. So it wasn't really about getting people more active, it was about getting them where they needed to go in the safest and most sustainable and equitable way. And we're out of time, but I'll just give you a link with a QR code. So we've got a lot more information, more case studies in our commission report and in our climate and health evidence bank. What we really want to do is to promote these examples of good practice through case studies of lived experiences. We've got lots of different examples on our website and trying to talk about equity across those as well. Thanks.
Thank you, Sarah, for sharing such powerful statistics. I think a lot of what you presented are concepts that we knew were likely true, but the Pathfinder report has really helped to articulate that and to give scientific grounds. So thank you to both you and Louis for such policy-relevant evidence. We're going to move now to Dr. Lalitha Surapaneni, who works as a medical practitioner for the University of Minnesota in general internal medicine. She's also got a public health degree from Johns Hopkins Bloomberg School of Public Health, and she's a board member with Physicians for Social Responsibility, my apologies. And she's going to talk through the different ways that we can move away from fossil fuels and why some of them are more and less just than others. Thank you so much.
Thank you. Thank you so much for giving me this opportunity. I'm sure everyone here has been paying attention to the unabated word that's been discussed, and so I wanted to focus on false solutions like CCS and why health equity needs to be central to a central principle to just transition. So I'm a hospital medicine doctor. I work at a transplant center. I take care of patients who have end-stage diseases. So I wanted to share the story of one of my patients. She had end-stage lung disease and was on the lung transplant list waiting for lungs. she was in her 50s and had this flare-up of her lung disease and needed so much oxygen that she needed to be hospitalized. And she stayed there for weeks. She would have multiple family members that would visit her every day, kids and grandkids. I had to navigate a lot of people to get to her bedside. And she would tell me about how she loved, taking walks, playing with her grandbabies before she had this disease. But the hardest of everything for me to hear was when we were alone, and she would tell me how she didn't want to die, and she wanted to live, and we were waiting for lungs that never came. And as I step out of this hospital world, my patient's lung disease was autoimmune, so this was something that we don't know why it happens. But then I start to think about the climate world and think about coal miners across the world who are getting black lung, which is 100% preventable end-stage lung disease. In the US, we are seeing rising cases of black lung disease in young men in their 30s and 40s. And I wanted to share a quote from a recent NPR interview that they did with a coal miner who had to text the reporter because he couldn't speak. He said, "I have a hard time just walking to the kitchen without losing breath. I am so tired and exhausted. As bad as I feel now, and I never thought I would say it, I so wish I had never stepped foot inside a mine." And fossil fuels, no matter which ones we're talking about, extol a human health cost. I mean, imagine that to power this room, to power our cell phones, our laptops, someone has to die, someone has to be disabled, or be diseased for the rest of their lives. Why? Why, when we have technology where we can transition to fuels that don't take this human health cost? And this is not just about coal, right? Like this, with fracking, we know that babies that are born near fracking wells are born low birth weight, preterm births. We see congenital heart defects at an increased rate. Elderly who live there have kidney disease, heart disease, lung disease, premature death. I mean, from cradle to grave, fossil fuels impact us. And this is the answer that nobody that's, I've talked to people in the OPEC pavilion and others from CCS where we talk about, well, what about the human health cost, the health equity cost of continued reliance on fossil fuels? And I encourage all of you to have this conversation if you are, running into those conversations of unabated fuel. And then the other part of it is when we do transition and we're thinking about renewable energy and where we're getting this, minerals, for example, and how are we getting this, there's a conversation to be had there as well. And that's something that we should not shy away from because there are still so many problems with responsible sourcing of minerals. What are we going to do with all of the waste that will be generated with solar panels and wind turbines? And so in these conversations, it's very important for us to bring them out into the open. And yes, those will be sometimes used against us in saying that, oh, let's just stick with fossil fuels. We already know what we're doing. These new technologies have a lot of problems. But if we don't center health and health equity in those conversations, we are at the risk of repeating those same problems that we're seeing now with the fossil fuel-based economy. So thank you so much for giving me this opportunity to speak. Thank you.
Thank you, Lalitha, very much. We're going to hear now from Professor Michael Kramer, Professor in Economics at the University of Chicago. And we're switching sectors now. We've heard lots on fossil fuels, and we're going to move to sanitation and thinking about the importance of resilient sanitation for improving health and equity. Thank you so much.
Great, thanks so much. One of the most basic human needs is for water, for clean, safe water. Contaminated drinking water is a major killer of children in low and middle income countries. Climate change is exacerbating this. So while I think many of the speakers have talked about the importance of mitigation, which is clearly vital, we're already seeing climate change, and that's impacting human health. And I think we also need to think simultaneously about adaptation. So in particular, on water, Why do I say that climate change is exacerbating these problems? Well, first, cyclones, floods, and heavy rain spread pathogens into drinking water sources, causing disease spikes, as we've seen with recent cholera outbreaks, for example, following Hurricane Freddie. Second, droughts can force people to move to less safe water sources. And finally, increased temperatures can accelerate the growth of pathogens in water. Now, this is something where there's already a proven, safe, and very cost-effective solution. And in much of the world, there's already access to this, almost universal access to this, and that's water treatment. But that's not available to people in other parts of the world. Just, I'm a researcher primarily, and recently did what's called a meta-analysis that combined 15 different randomized controlled trials, each of which on its own wouldn't have an adequate sample size to assess the impact of drinking water treatment on mortality. They were designed to measure diarrhea, for example. I don't know if it's possible. Wonderful, great, I see this is up. Perfect, that's the slide. Thank you so much. You can see the results on this slide. So each study is a dot here. The dots on the left of the vertical line represent a reduction in all-cause child mortality. The diamond represents the full meta-analysis results. We actually have this is 15 studies. We've got a revised version soon coming out with a couple more. But they both yield the same result. And a result, the direction of which didn't surprise me, but the magnitude really did. Water treatment can avert 1 in 4 child deaths. That's from all causes. Now, as an economist, one thing that implies is that, so the cost per child death averted is about $3,000 less for some delivery methods. That means that for a given budget, water treatment can save more lives than almost any other health intervention. In that respect, it's very comparable to childhood vaccination. However, unlike vaccination, most people in lower income countries don't have access to free water treatment. The world has recognized that every child deserves to be vaccinated against preventable diseases. That means access is really highly unequal. The status quo method for water treatment isn't sufficient, particularly in the context of climate change. Drilling boreholes or protecting wells doesn't fully protect against contamination. Selling water treatment, as is currently done, makes it less accessible for the poorest who need it most, worsening health inequity. We observe low take-up, single-digit take-up, when there's a fee for water treatment. So maybe we could go to the next slide. In rural areas of low-income countries where people, I can do that myself now. I'm sorry if I go backwards here. Where people collect water from springs or wells, one solution is point-of-collection dispensers like this one. When people collect water, they can add the right dose of water treatment solution by turning a knob. We evaluated this in Kenya. We found a 4-fold increase in take-up of water treatment sustained over 3 years. An NGO called Evidence Action has been implementing this at scale for a decade. They recently received $50 million to increase access in East Africa to 9 million people for 5 years. Now, we recently heard from the government of Malawi, this is in Scientific Evidence, it's the government report, that areas of the countries with dispensers had lower rates of cholera following Hurricane Freddie. They'd like to expand the program and ask that I communicate to the global community how important safe water is in light of climate change and the growing frequency of cyclones. There are other approaches like building on existing maternal and child health services, which already reach the vast majority of mothers and children, even in low-income contexts. Clinics already provide a package of essential goods and services. If you just distributed free water treatment solution and integrated that into the package, that would be highly targeted to the people who need it the most. It would target pregnant women and children under 5. And it would be accessible to the poorest, promoting health equity. We estimate that would cost just about $2,000 per child death averted. The government of Rwanda would like to move ahead with a pilot of this with a view to scale up. And then the final approach, and I realize I'm ending time, so I won't spend time on this, but the government of India is putting in piped water for all households. And just a few days ago, they announced that they would put in inline chlorination to treat the water. So this represents tremendous progress. We estimate this will save over 100,000 lives every year. I think water treatment's historically been neglected for a variety of reasons. I think the principle I'd like to highlight for just and healthy transition is to ensure that as climate change spreads infectious diseases, including waterborne illness, everyone has access to a basic package of goods and services that will help them be more resilient and allow basic health: vaccines, bed nets, antenatal care, and also water treatment. Thank you.
Thank you, Michael, for sharing such inspiring solutions. It's unsurprising, but unsurprising to know that the work that you've led over the years led to you being awarded a Nobel Prize in 2019, which I'm extremely sorry for neglecting to mention at the very start of your presentation. We're going to hear finally from Hannah Marcus, who is co-chair of the Environmental Working Group of the World Federation of Public Health Associations. Thank you very much, Hannah.
Thank you so much. Do you have my slides up there? Oh, sorry. Perfect. Thanks so much. Today I'm going to be presenting to you a planetary health approach to a just transition. I hope this provides a little bit of an optimistic outlook of what can be done when things are well planned and delivered in collaboration with communities. So where exactly does my case study take place? So if you see on this map, you'll see Genang Palang National Park, which is in Borneo, Indonesia. So this is a place where Canary Webb, who began as an ecologist, visited in 1993 to try to study the decline of the local orangutan population. This is one of the spots of highest biodiversity in the world, and she wanted to understand what was driving their extinction. But what she noticed when she got there were intensive and never-ending sounds of chainsaws from illegal loggers. Of course, she was initially resentful, thinking, oh, it's these people with, lack of regard for the environment that are driving this extinction of local species and leading to the decline of biodiversity. But then she began to talk to them. And what she heard were stories of impossibly large responsibility. Men who had to pay for their families' needs, including medication and emergency health care, while living in subsistence conditions. Those medical bills would leave most people in debt. And as it happened, illegal logging was one of the best ways to get fast cash. So with further investigation, she realized how the health of the community and their practice of illegal mining were deeply interconnected. Not only were their health needs driving the practice, but as well as that, illegal logging itself was leading to several health implications for the community itself. I won't get into these in detail for the sake of time, but in summary, the loss of the forest coverage was leading to a loss of the local root and canopy systems, which would otherwise filter the water, thereby filtering and diluting pollutants from entering the watershed. And this was leading to a high uptick of diarrheal diseases in the community, which was validated through external research. So what did Canary Webb do? Well, she abandoned her career as an ecologist, decided to go to medical school, came back to the community, and did 400 hours of what she called radical listening, which is an open-ended, community-led dialogue approach to understand exactly what interventions could be done to address these needs. She spoke to 500 community representatives, and by the end of the focus groups, villages had unanimously agreed that they could stop illegal logging if they had access to high-quality, affordable healthcare and training in alternative livelihoods. So how was the program designed? Well, first and foremost, it was recognized that in Borneo, the just transition demands that an alternative work solution be introduced so loggers can maintain their household income and not be disadvantaged from the transition away from logging. Because the issues were so interconnected, she also realized that the direction of a previously negative cycle could be reversed so that it could become a positive cycle. So what did they do? Well, they started by developing a local health clinic run by a local NGO called ASRI. This health clinic provided planetary health education to its patients alongside critical health services. Beyond that, they developed a chainsaw buyback program whereby people could give in their chainsaws for illegal logging in return for loans to develop small-scale businesses and training in entrepreneurial pursuits, including organic farming and goat raising. There was also a monitoring team put in place to try to disincentivize illegal logging by tracking illegal logging rates across the different villages, and communities with lower rates of illegal logging were given discounts on their health care. Patients could also pay for their health care with things other than just cash. They could pay for it, for example, with seedlings that were collected from the forest, or they could pay for it with various different organic inputs like fertilizers, manure, rice husks, and eggshells, all of which were then used by ASRI-established organic farming cooperatives. And finally, with the thousands of seedlings that they received from healthcare payments, they were able to support some large-scale community-led reforestation efforts. So for the sake of time, I can't go through all of these, but if you have a moment to look into the research on this, it's pretty impressive what was achieved, and this was validated through external research as well. You can see here there was a 67% decrease in infant mortality, 90% decrease in illegal logging, and 52% of previous loggers switched to organic farming. So as you can see, this model, given its success, is being now replicated in other parts of the world. This has yielded important achievements in various locations, and I believe it holds promise as a model for other parts of the world as well. So while I share this for you today, is not because I think that this specific solution should be adopted everywhere, universally. Of course, solutions need to be context adapted and tailored, but I think there are some key principles that are applicable and transferable to various other contexts. So for one, community needs need to be prioritized, community solutions need to be at the front and center, and communities need to lead the process. And that applies to all solutions developed in the just transition. And beyond this, interconnected issues demand interconnected solutions. And this requires connecting the dots between health, well-being, livelihoods, and the environment. So by presenting an example of the immense health, social, economic, and other co-benefits of a well-planned and delivered just transition, I hope I've shown you that solutions to one problem should and indeed can be harnessed as solutions to all. Thank you so much.
Thank you, Hannah, for yet another inspiring example of what works. And by some miracle, we're running about 4 minutes ahead of schedule. And it's very exciting. We've just learned that someone that was involved on the ground in delivering the project that Hannah has just mentioned is actually here in the room. And I wondered if there's anything that they would like to add. A little later, perhaps. Thank you so much. In that case, I'm going to hand you back to my wonderfully capable co-moderator, Shweta. One more thank you for the panel, and we'll switch to the final one now. Thank you.
You're a panelist. Joy's not here? Okay, we'll do the film then. May I request Michael? Where's Michael? Yes. And Victor? Please. Okay, please join us. Yes, now. Thank you. So, just said we had 4 minutes. We were ahead of time. We are right now on time. So, that's also good. Thank you so much. We had the setting of the context. We had the case studies of what works. I think the question that remains now, and again, in a really fast-paced manner that we are discussing just transition over here today, is what's the way, what are the solutions, what are the concrete ways forward? And to discuss that, we have we're still waiting for a panelist, but we have 3 really amazing panelists who will kind of help us unpack what what are the solutions, what are the ways forward. I would like to invite Michael Pollan, who is the campaign director for Fossil Fuel Non-Proliferation Treaty Initiative, to discuss some of the solutions or some of the ideas of possible solutions. Michael has helped launch the campaign for a fossil fuel non-proliferation treaty, I got that right, in 2019. He has supported climate justice campaigns and strategies to scale online and offline for over a decade, and he has helped lead campaigns on mass mobilization around the world with the online progressive engagement network, 350.org, and Center for Australian Progress, the Climate Council, Get Up, and Oxfam International. Michael, welcome, and you 5 minutes.
Thank you. I just wanted to start not with my own words, but with some words that were shared by Dr. Tedros of the World Health Organization just 48 hours ago here. Much like we can't address lung cancer without acknowledging the impact of tobacco, it is undeniable that over 75% of emissions stem from oil, coal, and gas, which not only harm our planet, but pose a grave threat to human health. In full support of the Fossil Fuel Non-Proliferation Treaty, the World Health Organization stands with you. Those were words that the Director General of the World Health Organization shared on stage next to the main plenary hall alongside 10 nation states who are spearheading the call for negotiation of a new mechanism to manage a fast and fair transition away from fossil fuels, a fossil fuel non-proliferation treaty. We've heard a lot over the last few days and weeks and months about the need to phase out fossil fuels. Pressure is building behind that demand every single minute in the negotiation halls here. The thing is, saying those 4 words does not make them become a reality. We need more than just words. We need immediate actions, and we need a concrete binding plan for how governments will work together to make this fossil fuel phase out not just fast, but also fair. And that requires international cooperation. We cannot leave this transition to markets. Governments have acted in collaboration with each other many times before, and the health community knows this. The Framework Convention on Tobacco is a fantastic model for some of the things that we can do to address fossil fuels. We've also seen frameworks to address the health and other threats of landmines, of nuclear weapons, of ozone-depleting chemicals, of cluster munitions, and many different things. Yet our international frameworks on climate change make no mention of the words coal, oil, or gas. Those words are simply not mentioned in the Paris Agreement. And while the negotiations happening here and this framework are critical to meeting our 1.5 degree target and must be upheld, they are falling short of addressing the primary cause of the climate crisis and a major threat to global health, fossil fuel production. And so that is why this powerful bloc of nation states from around the country, around the world, I mentioned 10 alongside Dr. Tedros. There are now 11 because yesterday the chair of AOSIS, Samoa, joined them, are spearheading this push to complement the Paris Agreement with a new mechanism to phase out fossil fuels. It has 3 pillars: non-proliferation, governments coming together to set a commitment to opening no new fossil fuel production; a fair phase-out, calculating the speed at which countries must transition in line with 1.5, but also equitably, where wealthy nations move fastest and give more time and carbon budget for developing nations to shift away their economies in a more orderly manner. And lastly, a just transition, which is critical. We cannot phase out fossil fuels with words, and that we cannot leave it to the market. Governments must work together to manage and finance a transition that supports workers, communities, and countries to move away to a better life, to a future with a safer climate, and one where health is protected from the grave threats of these products. And so This is a bold, big idea to negotiate a new treaty. It is gaining a lot of momentum from nation states, and I wanted to join you here today to say thank you, because before any of those nation states supported this proposal, in the very early days when it was just an academic idea, it was a small group at first and then a very large group of health leaders and professionals and institutions around the world that really threw their weight behind this idea. Dr. Kumar was one of the first health professionals globally to support it. The World Health Organization is the first UN body to formally support it. And we've seen many health ministers help take it to their governments and parliaments around the world. And so it is incredibly heartwarming to see the leadership that the health community has shown on taking forward this big, ambitious and somewhat terrifying proposal. And we have so much more hope that it will become a reality and it will be negotiated because of the support of the health community. So thank you.
Thank you, Michael. So today is the Energy and Just Transition Day. Today is also the Indigenous Peoples Day. And this is our absolute honor and privilege that we have Victor Carmen with us, who is the Indigenous Youth Climate and Health Advocate. Victor is a student at Harvard Medical School. Over the past decade, he has advocated for Indigenous youth, health, and climate actions across the UN system as the former co-chair of UN Global Indigenous Youth Caucus and a current member of UNFCCC Indigenous Peoples Caucus. Now, Victor is going to talk about the impacts of critical mineral extraction on health and how to ensure meaningful engagement of Indigenous communities. Welcome, Victor. Yes, it's working.
Okay. How matakiapi, Victor Machiapi, Hunkpati, Dakota, Nayaki, Imataha. Hello, everyone. My name is Victor. I'm a member of the Crow Creek Sioux tribe, of the Dakota people in South Dakota, and the Yaqui people in Arizona and Mexico. Today, I'm coming here as a member of my communities who are being impacted disproportionately, which is not new, by extractive industries, the construction of oil pipelines in our traditional territories. You might have heard of Standing Rock. I come from the Ocheti Shakomi, which is made up of the Dakota and Lakota people. And it was Standing Rock that took a stand that I think reverberated around the world. And I come from that nation. But resistance isn't new to us. We've been fighting this battle for over 100 years. They've been extracting resources from our communities and doing it by force when we resisted, and this is still happening today. Indigenous peoples today represent communities who are at the highest risk of being assassinated as frontline defenders fighting against extractive industries in our territories, from the US to Mexico to the Amazon, Africa. Anywhere where there's indigenous peoples, you'll find our elders and even our young people fighting against mines and the extraction of minerals. And when we're talking about the acceleration of this just transition, a lot of these rare earth minerals are still coming from our communities. We're still hearing stories. I know many indigenous peoples myself, elders who have been assassinated, brutalized, imprisoned for fighting against these mines. And is it really, for one, a transition? From our perspective, it's not, because it's a new form of extractive industry in our communities that is almost being supported by wealthy countries. And it's same old for us. We're still seeing the mining in our communities. When we're saying accelerating, how is that impacting the indigenous communities where these mines are being accelerated, where the withdrawal of these rare earth minerals is being accelerated? You'll see the acceleration of the health impacts on our communities, the poisoning of our rivers, the acceleration of the liver disease that comes from the chemicals in the water that we drink, the acceleration of the intergenerational trauma from the assassinations, the acceleration of violence against indigenous women and girls. When a mine comes in you see a lot of men from outside the community come into the community, and we see a rise in sexual violence against our women, our children, the girls in our communities. And that's not just from our perspective, and it's not a transition from our perspective. And so when we talk about a just transition, we need to talk about for who, and we need to make sure that within these policies, there's safeguards that respect the rights of Indigenous peoples, that respect the UN Declaration on the Rights of Indigenous Peoples, which is maintained as the minimum standard of how countries should respect our rights. One of the key tenets of the UN Declaration on the Rights of Indigenous Peoples is our right to free, prior, and informed consent. Before any project takes place on our traditional territories, we have the right to free, prior, and informed consent. And if we aren't giving that, then it shouldn't happen. There's a right way to do this, and I think it starts with listening to Indigenous peoples, including us in these processes, in these negotiations, helping to ensure that we have active participation, full, equal, and active participation in the development of these policies, from the UN level to the national level, to how policies are implemented in countries, for how mines are created, for how mines have to operate with respect towards our rights. And so when we talk about this just transition, I think I want to really challenge, because it reminds me of the green agricultural revolution, when countries were supporting massive amounts of genetically modified organisms that were displacing our communities as well. This was seen as sustainable, this was seen as healthy for the climate, something that would feed more people, when it was eradicating our traditional food systems, our traditional seed knowledge, eradicating our economic system, and essentially enabling an economy that that was violent towards our people. And this reminds me very much of that as well. And so I would like to, for people involved in these processes, to exercise caution and to understand that that we can't just gloss over the health impacts on Indigenous communities and the abridgment of our rights just because solar panels and electric cars seem better to us. We need to look a little deeper and have a more intersectional approach to how this is continuing to impact our health and the climate health of Indigenous communities, because we have 80% of the world's remaining biodiversity in our territories. And if there's increased mining and extraction of rare earth minerals in our traditional territories, that directly impacts that biodiversity that not only we rely upon, but everyone else as well. And so, we're in this together, and Indigenous communities, when it comes to our health, that's your health as well, that's the planet's health. We're the world's oldest caretakers of the land, and we want to remain that way. Our people are on front lines, fighting these mines right now, and we need increased support for Indigenous rights, frontline defenders as well, who, we need increased awareness for them to protect their lives, because they're being assassinated at higher and higher rates protecting their traditional territories. Thank you.
Thank you so much, Victor, for this perspective. This is really, really important and much needed. And it's something that especially the health community has been saying and echoing, that the socially and economically unjust patterns of a fossil fuel economy, which is also extractive, should not be repeated when we're talking about a transition to a low-carbon economy. So this should be our priority, and thank you so much for bringing that wisdom and sharing it with us today. Thank you. My co-moderator is the next speaker, Jess Bigley, who is the policy lead at Global Climate and Health Alliance and leads the GCHA's policy work, including raising the profile of health in UNFCCC negotiations and assessing nationally determined contributions and research and analysis to support GCHA's campaign asks. And Jess, we would need your help in unpacking all this conversation that we're hearing about just transition. How does this get reflected in the UNFCCC process, in the negotiation? So we will need you to guide us on that space.
Thank you, Shweta. Thank you, Shweta. Now.
A bit louder. Thank you.
I am truly humbled to follow the speakers that have preceded me today. I think the word humbled can often be used in a trite way, but I mean it from the bottom of my heart. The issues that have been covered today affect real people, real lives in real places around the world. And I think sometimes we can come to a COP and it's difficult to remember how the discussions that occur in these halls are connected to the real lives and the real stories of people around the world. And I wanted to try and link what's been said to what we're seeing discussed in the negotiations this week and where we can be advocating for different priorities and for involvement of the communities that are most affected by the current state of affairs, the current business as usual, but are also made vulnerable by unjust transitions. So how can we be calling for delivering healthy and just transitions in the remaining days that we have here in Dubai? We've heard a lot about energy transitions. Energy transitions are not the only transition that need to be just, but 46 million health professionals have called for agreement, progress towards the just phase out of fossil fuels at COP28 and a just transition to renewable energy. We really want to see this language show up in the mitigation work program language, in the GST, in the cover decision. But of course, as we also think beyond the energy sector itself and we consider how we're going to justly reduce emissions in the transport sector or the agriculture sector, which populations might be affected, how can we plan to make sure that we're not exacerbating inequalities in those transitions? These are also relevant for those same discussion spaces. Moving beyond the issues themselves to the communities that need to be involved, we know that COP is a space that is most difficult to access for the people that are already worst impacted by climate change. For those of us that are here, the best that we can do is to attempt to create space in future processes to bring the stories where they're stories that it's appropriate for us to be telling, and making sure that these are reflected on the stage that we find ourselves on here in the UAE at COP28. I'll close once more by just thanking everybody that shared their experiences, their knowledge, and the evidence today, and ask if we can collectively gather this and take it forward in conversations, in advocacy that we might be engaging with around the negotiations, to hope for an outcome of COP that is both sustainable but also healthy and just. Thank you very much.
Thank you so much, Jess. I'm just wondering, we have, we have our speakers, some of our speakers in the audience, and I just wanted to invite all the panelists to the stage and see, some of our panelists have left because they have other meetings, but we might have to get a couple of chairs, but that's fine, because now for the next about 12 minutes, we'll have question answers. And if you have any comments, questions, so please, panelists, join us. And so we might need one chair. And just, one more.
One more chair?
One more, yes, please.
I'll put it on the center. You're done. No. We can't have more people. We can't have extra chairs. Okay.
Jess, why don't you join me over here? Sir, please come. Okay. We'll co-moderate this thing. Okay, I see questions. I see 3 questions. Let's start from here. Sorry. Guys, we'll come to you.
Thank you. This is a good choice because today is Indigenous Peoples Day, and I am the president of the Sea Foundation Sustainability, Health and Education, and we work with Maasai communities in the border of Kenya and Tanzania. So it was excellent, this panel, and what you are bringing about is what we have to be looking in just transitions. And please remember to talk about equity. The way of talking about human rights and rights of Felipe and what Victor was saying is the unspoken story, and I would like to invite you to work across the nexus and to forget to work in silos. You mentioned agriculture, but I am also the lead author of the IPBES. It's like the IPCC for biodiversity, and I invite all of you to make comments to the actual chapter on climate change and energy, and we are looking across the nexus: food, climate change, energy, food, health, biodiversity, water, and we need the health community to comment. It's there for, I think, 30 days. Please send your comments as health practitioners. There is a chapter of health. They don't talk about energy, they don't talk about transitions, they don't talk about systems. Look at the chapter of health, but comment in the one of climate change. Thank you so much.
Do you want me to?
Hi, thank you so much. I'm Chelsea from the Climate and Health Alliance in Australia. I just want to acknowledge the Gadigal people of the Eora Nation, where I'm blessed enough to call home. So thank you so much about raising the point about, you know, it being much the same as usual for you in talking about mineral extraction. I would really love to hear a little bit more about how you are engaging with civil society and kind of the environmentalist movement, I suppose, in these discussions, because while on the surface it would seem like they're natural allies, I feel like this movement and this momentum towards a transition that would involve the continued extractivism would be complicated. So I'm really interested to see, hear about your experiences of that and what you could share. And also, if you can, any thoughts on how organisations can be good allies in these conversations?
Thank you for that question. I want to make it very clear that the Indigenous Peoples Caucus is unanimous in that our position is we want to phase out fossil fuels. We know that that is necessary, and we fully support that. And we put out a position paper on this. Anyone is welcome to read it. I think, you know, when talking with other sector, you know, civil society, I think all we're saying is we want Indigenous rights safeguards in this process. We want it to be intentional. And I think that most people, you know, when we explain that, I think can understand that we're not saying, you know, let's not transition. Just transition in a way that respects our rights, and I feel like, you know, that's been enough for most people, and there's not really much else for us to say, you know, just, you know, respect our traditional territories, and we already have the UN Declaration on the Rights of Indigenous Peoples, and most countries are in support of that, and usually we send them that as well, and so, you know, but obviously we still have a fight. There's people, you know, that I think need to be convinced still, and I think a lot of it is just awareness and education around our positions.
Thank you. I come from Argentina, and I thank you for your words. We have territories that are affected by lithium mining in the name of this transition that is promoted by the Global North, which implies a huge threat for the integrity of our ecosystems and for the lives of the indigenous communities who live there. So I would like to make a call on and a reflection that we need, of course, we need an energy transition and to phase out fossil fuels, but we need to make a call on the reduction of the demand of these minerals.
Yes.
Because we are just perpetuating a model of development that continues to imply a degradation of our ecosystems that naturally capture carbon dioxide, and which is degradation provokes the release of such gases, even methane, and prevents the community from adapting to the context of climate change that it's already having impact, severe impact on these ecosystems. So it is needed a comprehensive social and ecological transition, but needs to be built with social dialogue, with democratic participation, and with environmental justice, but above all, like you said, with the respect for human rights, because FPIC is not complied with, and we have many laws that are advancing on our ecosystems, and it is very hard to speak of a just transition if human rights are violated. So if you have any comments on the reduction, because that is something that we don't listen to much, the reduction of the demand of these minerals, and to think this is transition is for what, for whom, which way. So any comments on this? I thank you for the chance to share this as well.
Thank you for that. I'm not an expert in energy or anything like that, so I really appreciate that. And I think there's definitely room for innovation to reduce, the demand for these things, longer. I think, this isn't the end. Let's keep innovating, try to make these technologies more sustainable, and try to, rely less on them just as humans, and invite anyone else to comment on that as well.
Yeah, so, I think with what you mentioned with reduction, I think is such an important point. And when I think about the minerals, primarily like in the transportation system, right? So often the conversation is kind of trying to put us into two boxes. And so I would like to take a step back and once again think about centering health and health equity in these conversations. So the choice cannot just be how do we move in a good manner from a gas car to an electric car, right? It has to be, how can we create the healthiest transportation system that benefits everybody's health and also improves mobility access to everybody, right? Currently in a car-based system, people who are differently abled, children, many people can't drive, can't move themselves in the way they want to and access healthcare services, appropriately in a timely fashion. But if we put health at the center, think about active transportation. How do we expand walk and bike infrastructure? How do we expand public transit? And then the rest that can't be covered by that, sure, can be done with EVs. But at the same time, I think degrowth is a conversation that we absolutely need to have, and responsible growth and health professionals, I think, are poised to do this conversation the best because, whichever topic that we consider, when we talk to our patients, you can't just eat candy all day, And so I think even though the shiny baubles of development are beckoning us, I think a health-centered approach is kind of where we need to go.
Thank you so much, Lalita. Comments? Yes. Sarah and then Dr. Kumar.
Yeah, I'll be very quick. Just to echo that, I think putting health at the centre really is the key. And what we need to do as the health communities, go out there and convince other communities. Everybody needs to be integrating health. Everybody needs to become a health professional. So building designers, transport designers, every sector needs links to health. They need to understand the health impacts, the health opportunities that exist if we really want to make those changes. I mean, we're not seeing that people are getting happier. They're not getting healthier, they're not getting happier. We need to look at every single sector, the way we move, what we eat, the way we live our lives, power and heat our homes. And if we could try and, as a community, go out and make those cases to all those different communities and really show them the positive health outcomes that could be delivered, then potentially we'll see some more systems change that's needed.
Thanks, Sarah. Dr. Kumar.
One of the things which is not being discussed is attempts at decreasing our demands. If you trace the consumption of fossil fuels in the last 3-4 decades, yes, they are bad. But one of the reasons why we are facing such horrible outcomes or results is because their consumption has gone up like this. And I would dare say that I don't think there would be any technology which would be 100% human safe. Solar energy, also we were discussing this about lithium-ion battery or some other types of battery. I think if the demand for those goes in a spiraling manner like this, the way fossil fuel has gone, a stage will probably come, maybe not today, maybe 20 years, 30 years down the line, where you would have a huge amount of waste coming from those energies, and maybe a COP 40 years later would be discussing ways how to move from that to a relatively more safer energy. So I think while we talk of moving to safer energy, one more area where each one of us, health professionals and every other sector, must talk about is attempts at reducing the demand. And Sarah mentioned about a study in Victoria, Australia, where by doing some modifications, the demands of those houses went down and the carbon emissions went down. So similar attempts across the globe, across all sectors, would also be an important step to take.
Thank you so much. Do you have any comments? Any questions? Oh, yes. Andrea and then Chelsea, and you had your hand up, right? Okay, so maybe Andrea, you, and then Chelsea, because Chelsea, yeah, great.
Thank you. Very quickly. I'm Andrea with Healthcare Without Harm Latin America. My question is for Hannah. Thank you so much for the case study that you shared. I think we've all heard of health as a powerful driver of climate action. I don't think I had ever heard of such a clear example of how lack of access to health is a driver for extractivism. My question is, even accounting for the savings that presumably the community has had from now having access to a health clinic, are the alternative livelihoods that they've been training the community to engage in equatable to illegal logging in terms of income? And if not, which is what I'm assuming, what do you think is the role of other stakeholders, and particularly government, in subsidizing or making, compensating for that difference? Because that's where the resistance comes from, right? I mean, we're talking about people's incomes here. So I don't know if you can comment on that. Thank you.
Yeah, thank you so much. And actually, it was a really pleasant surprise to hear that there was someone in the room from Health in Harmony. It's an organization that I've long just looked towards in awe. And this case study inspired me since I heard it in the Planetary Health Alliance case study series anthology. Anyways, that said, yeah, it's a great question. I will admit I'm not an economist, and I won't pretend to be one. But what I do know is that, from my understanding of discussions I've been involved in, the cost of these things and the demands for different products are very much market-driven. And when it comes to things like illegal mining, while it may be a lucrative industry, we also need to question why it's a lucrative industry and what government policies are in place that make it a lucrative industry. And those come down to things like subsidies and the types of materials that companies use in their products, using timber-based, using carbon-based products. And part of the entire energy and just transition itself needs to be moving away from those things, not just in terms of the economic models of production, but also the way that governments structure the incentive policies so that companies want to move towards those things because they're cheaper, because to be frank, they're not going to do it out of the goodness of their hearts. So I think that, to answer your question in kind of a convoluted way, I don't know necessarily if there were studies, if the studies have been done to show that these alternative livelihoods that they provided to these people were necessarily proven to be more lucrative or financially sustainable in the long term after the withdrawal of NGO funding and support for this community, in the targeted approach that it was done by Health in Harmony. But that said, to create a sustainable way that this can be replicated in other locations, it requires a larger scale economic transformation towards reducing the incentive structures that drive things like illegal mining on the demand side as well. Because at the end of the day, people are going to do what they need to do to survive, and if the market pushes them to do things that are destructive to the environment to survive, they will. And so the market needs to push them to do other things, better things, yeah.
Thanks, Hannah. We have one last comment and we have a minute. So if you would like to, because we're very strict about closing, so quick comment.
Okay, thanks. My name's Emma Lawrence. I'm from the Climate Care Centre at Imperial College London, and I grew up on Kaurna country in Australia, so I'd like to pay my respects to elders past, present and future. I'm struck by the diversity of the panel. We've had the first health day at this COP. You're all touching on health in different ways in the just transition. I'm just curious on what has excited you, what have you felt is of value in this COP so far, and how would you measure the success of this COP for you?
We have 30 seconds, so 2 words literally. Do you want to start, Dr. Kumar?
First time where health has been given a center stage. And I think every panel discussion, every lecture, every address from the podium has discussed health, health, health. I think it's a major, major development.
Thank you, Sarah.
Well, I'd just really like to, it sounds a little self-serving, I'd really like to thank the panel, especially GCHA, Healthcare Without Harm. It's amazing what we can do when we come together and talk with one voice, and just kudos to you for bringing this community together to sort of come up with a set of core, powerful, key messages that we can really use to affect change.
Just briefly, I think just seeing that health is not only viewed now as a separate pillar within this agenda, but that it's foundational to the very things that we already want to do.
Thank you. Two words. I mean,
Colombia's leadership.
Lalita.
Community.
Thank you. Victor, you get like 3 words because two.
So there's no climate health without Indigenous rights.
Thank you. So,
जीना हम लोग का बहुत मुश्किल है।
सब्जी लगाओगे तो सब्जी पूरा नष्ट हो जाता है, प्रदूषण की वजह से, राखड़ धूल मिट्टी की वजह से सब्जी नहीं होता है।
दीजिए रोजगार विकल्प का।
here is the video, but let's see.
Just transition is when political representatives of the people respond to the needs of the people first. It is about ensuring that procedural justice, distributive justice, and restorative justice are the building blocks of the future. If the process of just transition is not just, outcomes will never be. Health is at the core of any transition and is paramount to justice. Let's put human health, human rights, and a healthy climate at the center of our vision for the future. While a transition is inevitable, a healthy transition is not. Let's make it happen.
And with that, thank you very much. We are within time. Thank you very much. Just would you like to say something? For being here, we have more resources online, and we'll be happy to share or respond to any questions or comments or feedback that you have. So thank you very much for coming.
I'm so